We are talking about interventions to improve quality in health care, and for better or worse, I think actually for better, but our point of departure has been that to really make definitive, credible claims for improving quality, you really need to not only do great research, but publish it in a high-quality, non-nursing journal like the New England Journal of Medicine, JAMA, depending on the focus, Health Affairs, Health Services Research, and medical care, and other places like that, partly to provide and preach your message to a broader audience, but partly to obtain the credibility with decision makers that goes along with that kind of publication. I was here last week at RWJ. I'm a train buff, actually, and I'm thinking of buying a pied-à-terre at Princeton Junction. So this is going to keep up. But Elizabeth Bradley from Harvard spoke about it was a meeting called the Funders Forum, where a lot of foundations came together to talk about this puzzle of how to take things that we've funded, interventions we've discovered that actually work really well, how to actually get them adopted in real life. And so Elizabeth talked about her success in getting an intervention that was basically directed at reducing the time between when somebody showed up at the ER door with symptoms of heart attack to when they got to the cath lab, how to shorten that time, and mentioned, and I was silently cheering, that publishing the New England Journal article made a major impact, not only on the CVs of the research team, but also on the credibility that could be offered for this intervention when they took the show on the road, tried to persuade people to do that. Now, in other areas of business that I study, like property casualty insurance, you don't need a peer-reviewed article. Of course, what happened to AIG, I guess, shows which peer-reviewed article might not have been a bad idea, but in healthcare, the way we define truth is in part through that mechanism, and so we think that's important that you're going to be able to do that. There are two other dimensions of things that I'm kind of watching for that will be sort of touchstones for whether the I really is present in inquiry. One is, will there be, for most of our projects, again, publication isn't the be-all and end-all, as I'll mention in a moment, but it's a necessary condition, I think, for success and dissemination. In addition to the article in the major journal, and probably the article in the nursing journal, will there be an article in the disciplinary journal? Heather's compiling a list of papers. I hope we'll see some there. I think we probably haven't emphasized that too much, but not that every collaboration necessarily leads to an article for the person who kind of contributed the tools. But if you're really engaged in things, almost anything turns out to be interesting. And if you're from another discipline, if you're engaged in an application to nursing, the odds are, I hope anyway, and I think are really good that you'll discover something that people in your discipline will be interested in hearing about, if only it's how we took our beautiful tools and had to torque them around a little bit to fit this crazy nursing situation, but it really worked out fine in the end, or whatever your story might be. I'd like to see that published. The other thing is, and we try to observe this as much as we can, we're seeing some of it, the extent to which the non-nurse really gets excited and behind and pushing the research. That has happened a fair amount. We're seeing a bit of it as people apply for continuation of their research. I know Heather's voice is in my ear to tell you these grants are not, you cannot ask for extensions. You have to finish them on time, so don't plan to finish up your research later, but we are sympathetic to the idea of additional work beyond the original proposal, either in terms of substance or in terms of dissemination. And I guess what's pleased me most is that in some cases it's pretty clear that the interdisciplinary researcher got excited and is actually pushing it and asking the nurse researcher, can't you come up with some other brilliant idea that we can also push forward? So that's all great. And finally, and I think this is still a kind of open question for me, so we do think dissemination is important. That's a hallmark of this program. And the question is how the non-nurse researcher can contribute to dissemination. You know, I know having a charismatic economist is going to take you a long way for dissemination, but I'm not willing to rely on that 100%. And among the other things that you may want to think about at this meeting, especially if you are the non-nurse researcher, or even if you're the nurse researcher, or even if you're an interested hanger-on, how to turn the interdisciplinary character of this program into something that has a lot more firepower and horsepower when it comes to dissemination, as well as conduct and getting those papers published. Beyond that, what can we do to make the team really work well together? So I'm hoping we'll talk about those things a good bit today. I'm happy to be back for the family reunion. Welcome, everybody.